Hello, everyone. Welcome to 5 Steps in Healthcare's Social Media Agenda, a Peppers & Rogers Group webinar. I'm Liz Plagowski, Executive Editor of Strategy and moderator for today's event. Now, before we get started, you'll notice here on the first slide that we have a Twitter hashtag. Oh, actually, I'm sure it's not showing up. So we do have a Twitter hashtag. This is a social-related event, so we want to make sure we're making use of social media. So if you have attended a webinar in the past, you'll know that we use a Twitter hashtag called PRG Healthcare. So feel free to follow along via Twitter or retweet some tweets. I'll be live tweeting throughout the event once the presentation gets started. So let's introduce our speakers today. First we have Mark Ruggiano, a partner at Peppers & Rogers Group, and also Dietrich Chen, a director at Peppers & Rogers Group. Both of them work in the healthcare practice, where Mark has brought a wealth of experience and cross-industry expertise to lead Peppers & Rogers Group's healthcare practice. He will emphasize the importance of social media, specifically for those in the healthcare industry, so he'll get the conversation started. After that, Dietrich, who leads our social media consulting projects, he will share the 5 steps to social media success, including best practices from around the industry. So before we begin, I've got a few ON24 logistics for you. For a PDF copy of today's presentation, you can click the green PDF icon button at the bottom center of your screen. We also will have another PDF download available, which Dietrich and Mark will share with you later in the presentation. And if you encounter any issues with the PDF download, you can notify us with the purple Contact Us button. We also encourage you to submit questions of our presenters at any time during the event. There's a Q&A button on your screen, so you can just click that, type your question at any time, and hit Submit. We made time at the end for a Q&A session, and we will answer any questions you have, which will be discussed anonymously. Also, as part of our interactive experience, we have peppered a few poll questions during the program for you. So we ask that you participate with those poll questions. We'd love to hear your feedback. As well, at the end of the event, we have a brief survey to get your feedback about the entire presentation. Now, there's a list of FAQs to the right of the enlarged slide link, and you can also submit a question if you're having any technical troubles as well. Our technical team is on hand to answer any questions you may have. And at the end of the program, if you have questions about the content or the topic, there's contact information for Mark and Dietrich that will be posted at the end of the event. All right, now let's move on to today's agenda. So, as I mentioned, Mark will begin with an overview of the importance of social media strategy as it relates to the healthcare ecosystem. Then Dietrich will share the 5 steps in healthcare's social media agenda, including some best practices. And Mark and Dietrich will also help you conduct a self-diagnosis with a few tools, including a social readiness checklist, which they will detail later in the program. And so with that, let's begin. Mark, I'll turn it over to you if you want to start things going.
Sounds good, Liz. Thank you very much. To kind of get the discussion started, I'd like to spend a couple of minutes talking about some of the things that are affecting the world that we live in general, and in particular how those are beginning to really become visible and impactful in healthcare. The first slide here, I think, makes a point that many of us who spend time working in or working on the social media space, and I know the bulk of our audience today falls into that category, we know that these trends are happening. Consumers, which, in one phase of our lives and one portion of our day, we are all consumers. Consumers, are changing their media consumption habits, and that has had a profound effect on many companies, many industries, many firms and agencies that do work and are experts and provide support in the form of advertising, media buying, consulting, and marketing. All of the various things that go into the mix. So, this is a trend, this shift that has been going on, and we I think that the fact that it is changing is no longer in dispute. But I think we are, depending on the media that you're talking about and the particular area of social that you're focusing on, I think we're at a point now in several of them where the weight of the activity in some of these new areas is significant enough that we need to talk about it beyond just the trend, beyond just the change that's taking place. And we need to talk about it in terms of the substantial volume of activity and attention that is being focused in new places or through new channels. And a recent Viacom study, which some of you may have seen in the headlines over the last few days, is one example of this. The Viacom study said that 15% of total TV watching, and actually it's just watching of full-length television shows, takes place on tablets. And so making the tablet by far the second choice among TV consumers. And so this is one example of what I'm talking about, where it's not just the trend anymore, it's the impact of it. And that's why this discussion is more critical now than ever. Some of the stats that you see on this slide are, really just emphasize the point that social media has become omnipresent. Right? It's not just a novelty, it's not just a hobby, and it's not just something we can keep an eye on. And beyond being omnipresent, it's highly impactful. You can see some of the stats here, and we'll talk specifically about some stats released in another very helpful report over the next few slides that show how this is manifesting itself in healthcare. What you see on this next slide is the prevalence of information-seeking activity or information-sharing activity among consumers as it relates to healthcare. And you can see that there are some critical issues being addressed, being investigated, being explored by consumers. And if this slide doesn't make the point that this is critical and can't be ignored by healthcare companies, then I think we're really ignoring the facts. You can see that reviews are at the top of the list here. They break down fairly evenly into reviews about medications and treatment, reviews about doctors, reviews about hospitals or other facility-based healthcare players, and reviews about health insurers. And what's, I think, an interesting takeaway, an important takeaway from this slide, is that consumers are depending heavily on social media to help them with their decision making, and that's a theme that we'll see throughout our discussion today. On the next slide, you can see how consumers are using social media in terms of the activities that they are attempting to perform, and in many cases successfully performing through social channels. You can see a couple of interesting sort of combinations here. On the left-hand side, you see the second and third columns, which highlight the prevalence of consumers discussing their own or others' health online. You can see anywhere from 24 to 27% of consumers are falling into the category of people who are using social media for those activities. Another one right there in the middle is an interesting one to focus on. Tracking and sharing information about health symptoms and behaviors, right? So people are increasingly using social media as a tool to manage their own health and improve their own health status, which should be music to the ears of all of the insurers, payers, life sciences, and other companies that are represented in the call today. The final category that I wanted to point out really combines three of the four on the right-hand side of this page. Consumers are looking for information to help support their own decision-making. And the three categories that you see here all relate to reviews, and they are proof of this point. Again, social media is a critical tool that consumers are using to support decision-making that's critical to their health, and that's a theme to keep in mind. On the next slide, and the one that follows it, you'll see some additional details about the things that consumers want to be able to accomplish, what they want to be able to do online or through social media channels. And rather than go through these item by item, I think what we can see on this slide and the one that follows it are that there are really 5 categories of things that consumers are looking for. The first one that we can point to is really the decision-making one, which I've mentioned a couple of times. The information, and in particular the sources of that information, which I'll come back to in just a minute, are critical when thinking about this category. So information from trusted sources, information from reliable sources, those are obviously critical, but what's more difficult to get our arms around and more difficult to manage is that trust and reliability of information doesn't mean necessarily that it comes from a personally known source. And so that's something that is unique to this channel as we try to figure that out. The second one to think about as we look at these activities is convenience. Social media, as it's been used in other industries, is really gone a long way toward training consumers to expect convenience in how they engage with companies. And that is definitely true in healthcare. We see a definite theme around saving money. We see a theme around the desire to engage in social media for customer service purposes. And we see a final theme here around using social media as a tool for improving health. Here you see a similar slide. This one is in particular about the factors affecting consumers' health decisions that they make on the basis of information that they find through social media channels. And this is underscoring the point that I've made a couple of times. The last slide in this introductory section really ties this with the trust theme that we have talked about in the past couple of webinars that many of you have joined us on. As this slide shows, consumers that trust the source of information, trust their doctor, trust their hospital, their health insurer, company, are much more likely to share information with that entity. And so this link between trust and the willingness to share information, really the willingness to engage in building a relationship using social as a tool or a channel to do that, right? That linkage is a tight one, and that's why when we talk about trustability, it's part and parcel of the conversation about social media and the role that social can play. So I hope what you've taken away from these first 4 or 5 slides is that social media is not a novelty anymore. It's a critical form of media and a key channel in any multi-channel communication strategy. It is a more powerful tool than any other that we currently have at our disposal to engage customers efficiently and more deeply than we have been able to previously. My colleague Dietrich Chen is going to talk about the 5 steps that we believe healthcare companies should be taking to really take advantage of and position themselves well to utilize social media tools. Dietrich?
Thanks, Mark. Social media. As we've seen, social media is here to stay. Healthcare companies need to start paying attention to it. The following is a discussion on how to get started and is a descriptive 5-part plan for social media success in the healthcare landscape. I will go through what we mean by the 5 steps, as well as give examples of companies to illustrate the various points. The first step is understand it. This really is all about understanding and getting familiar with some of the social media channels and concepts. So for example, everybody knows about Facebook, Twitter, but there are more healthcare-related sites like Patients Like Me, Thermo, to really understand, what these sites are about, is to gain an understanding about what social media concepts are out there. Observe from other companies how they use social media both in and outside of healthcare. The second step is embrace it. The questions here that we typically ask are the following flavor. Is your organization committed to making social media a formal part of your business? Do you have a budget that establishes investment resources? Do you know which areas would most benefit from social media? And do you have social media training in place for your employees? The third step is observe it. Before you jump into any social media activity, you need to understand your audience and the type of information they are seeking, who they're conversing with, and what the topics are that they're discussing. This part is called listening. Where do you listen, and what do you do with the insights and information gathered through your listening program? The fourth step is explore it. Now that you have some insights into your audience and the type of discussions they have on social media channels, as well as some knowledge about what other companies in your field are doing with social media, it's time to explore the social media world. Have you identified a few social media pilots or proof of concept? And are you capturing the learnings and incorporate that feedback into your new pilot? Are you then able to extract data from your pilots to build a business case for future investment? These are some of the questions we ask during this step. Last but not least is include it. Make sure that your social media initiatives are not done in isolation with the rest of your organization. What we often hear from our clients is that, yes, we have lots of social media initiatives going on, but none of them are connected to each other, let alone to our overarching corporate strategy. So we need to make sure that social media is part of the overarching corporate strategy with the requisite budget and support from key stakeholders. As we go through the 5 steps in more detail, we have some poll questions at the end of each step to learn more about the audience here today and what you are doing right now or not doing with respect to social media. So let's jump right into the first step. Understand it. Companies in healthcare are typically a bit slower to adopt social media practices than other industries, and that has a number of reasons, all of which you are probably aware of. The regulatory aspect in healthcare seems to create a lot of confusion and hesitancy, and in addition, it is a fairly new channel, so that the ROI is often unclear. If the ROI is unclear, why invest in something that we don't know how to measure yet? But as Mark explained earlier, social media is here to stay, with consumers being active participants and seeking more and more control of their own health and destiny. Therefore, understand it means the following. Familiarize yourself with social media concept tools and vendors. Learn from the experience of early adopters, and understand which social media channels are most appropriate for your specific goals. Also, for those of you who are already participating in social media activities, you need to make sure you are up to date on all the new developments. For example, the latest FDA guidance on new media with respect to unsolicited medical inquiries came out in the beginning of this year. If you're on Facebook, Facebook's introduction of a timeline feature may change the way you need to design your Facebook page in order to conform to these new guidelines. And they may also impact the way you actually run your page. A good example for a company that has understood social media is GSK. It leverages social media in a variety of ways. It has a corporate Facebook and Twitter account, and it shares company news on them. For journalists, it uses Flickr to post photos so that journalists can use those. Videos are posted on YouTube to cover topics from corporate news like financial performance to GSK's philanthropic activities. It also uses the professional networking site LinkedIn for networking purposes and recruiting. Liz, can you start with our first poll question, please?
Absolutely. Thank you very much, Dietrich. Yes, so on the topic of step one, we've got a question for you all, and that is, how aware are you of what other organizations in your field are doing with social media? So are you very aware, somewhat aware, or not aware at all? Because understanding what is happening in the industry is the first step. So if everyone wants to take a moment to submit their answers, we will show those results in a moment. And okay, here we go. If everyone's taken them. We've got, looks like 55.5% are somewhat aware, another 30% are very aware, and 13% not aware at all. So that just, it's great that some of you are keeping tabs of what's happening in the industry, but it seems to me that there's some opportunity to do more. So thank you for your participation, and on to step two.
Excellent. Thank you, Liz. Yeah, I think that that poll question kind of reflected our feedback from clients, that they do know in general what's going on, may not know in detail, but most of them do have a rudimentary understanding of social media activities by their competitors. So the second step, let me just see whether it's being pushed. There we go. So the second step is embrace it. Healthcare companies must embrace social media by the following activities: making it a formal part of their business, establishing a budget reflective of their goals, determining which areas are most relevant for them, and making social media education a part of the employee training curriculum. Last but not least, designating a social media subject matter expert or group. A lot of the time, we see social media activities in multiple parts of the organization, sometimes in communication, marketing, with different objectives and not necessarily coordinated. Good example for a company that has embraced social media is Roche. Roche has gone so far as to publicly publish their social media playbook. We've provided the link here, so please check it out at your leisure. What a social media playbook does is communicate the company's philosophy on social media, establish a set of ground rules and principles, and guides employees on how to communicate in social media channels. Different companies obviously have different playbooks, but a playbook serves as a guide that governs who is authorized to respond to comments, in which way, what the response times are, and so on and so forth. So we've summarized Roche's social media principles here for you. There are different rules for both personal and professional online activities. Since social media has grown in leaps and bounds, your employees are most likely active on social media channels already when they're not on the job. So it is necessary to address both the professional and personal aspects of your employees' activities on social media. Some principles here, we don't have to go through them in detail, but some principles here highlighted for personal online activities are only share publicly available information, be transparent about your affiliation, and ensure that opinions raised are your own. For example, Coca-Cola requires that each employee discloses that he or she is a Coca-Cola employee when they mention a Coca-Cola product. Act as a scout for sentiment and critical issues. And here are some rules for professional online conduct for Roche employees as well. Again, the copyright, mind copyright, and give credit to the owner. Identify yourself as a representative of Roche, and know and follow Roche's record management practices. There are a few others here that you can go through in more detail at your own leisure. I think with that, let's have a second poll question that reflects the second step, Liz.
Sure. That's a great example with Roche. It seems that there's a lot of concern about privacy and regulatory compliance, and having some guidelines to keep people involved, keep people along those lines while giving them the flexibility to embrace social media is a great step. So along those lines, a lot of times in order to create and manage some of those guidelines, there need to be some social media teams or experts dedicated to such activities. So our next question is, do you have a designated social media expert or group within your organization? So if you want to take a moment to take that question, take the poll, either yes, no, but we plan to, or no, and we have no immediate plans to have a designated social media expert. So this will be interesting to see how much, the results of this one. So let's finish up taking your polls, and I will push these results. So great news. It seems that a majority of you do have designated social media experts within your organization to work on activities and focus on social media as it appeals to the entire business, which is great news. So thank you for taking that poll, and on to step 3.
Thank you, Liz. Step 3 is observe it, and this is all about social quote-unquote listening, where you define objectives and goals. For example, trigger alerts for adverse events, the critical aspects for healthcare companies. You need to decide where to monitor. What are the most frequented social media sites? Facebook, Twitter, forums, and blogs. Develop an interaction plan that details what you do with the information gathered. How you respond to complaints, or do you? How can you leverage advocates for your product? And then create a comprehensive monitoring strategy, including a formal listening program. There are a few interesting examples that I want to go through here. Let's start with UCB Pharma. UCB Pharma is a global biopharma company that focuses on severe diseases of the central nervous systems like epilepsy and Parkinson's, as well as immunological diseases. UCB Pharma has a comprehensive listening program. It gains valuable customer insights by listening into conversations that are happening among patients on sites like Patients Like Me. And those insights are used to shape clinical trials and also the messaging that is being put into marketing communication. UCB Pharma also scans for adverse events. It has vendors it works with to scrape conversations patients are having online and identify keywords that could represent AE issues. It is estimated that about 2 to 3% of all comments on healthcare-related conversations are about adverse events. Here are a few quotes that illustrate the importance of the listening program at UCB Pharma. It's important that we are listening and not afraid of adverse events. If you're not listening authentically and if you're not being open, you're sending a message that we really don't want to hear from you. Lastly, we listened to patients passively, and we heard something, a nugget of information that helped us narrow the field. We talked about GSK before, but GSK is another good example for listening. We don't have slides for that here, but GSK was noticing negative comments and concerns about a newly launched over-the-counter weight loss drug, Ally. Some comments that you could find on social media channels were of the following flavor. It's the only small result that is certainly not safe or desirable with all the nasty side effects, or this product not only did not work, it caused a bowel problem, constipation, that lasted for 3 days. There are other comments on the social media sphere, but we left them out due to its graphic content. You can imagine graphic comments when you hear bowel movement. But as I said, let's leave them be. But to combat the consumer confusion and concern, GSK set up the MyAlly community site. So when consumers go on myally.com, they find a comprehensive site with straightforward, detailed product information, which helps the company mitigate the effects of information it cannot control. So the community features facilitate a warm and supportive experience. It has active forums, it features videos, FAQs, has interactive diet tools, links to partners, sweepstakes, tie into TV and print advertising campaigns. Just briefly, a third example. The third example is Cigna. Cigna communications and customer service staff monitor what is said about the firm on Twitter and respond to complaints. When a Cigna member or physician complains about Cigna on Twitter, someone at the company sees it and responds. So even if the person ignores the response from Cigna, at least there's a public record that the company tried to respond, and everyone who saw the complaint can see the response. So I think these are all very interesting examples for the value of social listening. Liz, let's have another poll.
Okay. Yes, I really do like this step, especially voice of the customer. Social listening is so important, not just for consumers, but also for finding out what potential consumers might be talking about, new product development, competition, and what's happening. So really, social listening is so important, and a formal program is that much more important because, as you mentioned, it's way more than just Facebook and Twitter. There's so many avenues for consumers and people to discuss healthcare. So that leads into an obvious poll question, which is, I'm sorry, that was my fault. Let's go back to the poll question. And the poll question is, do you currently have a formal social listening or monitoring program in place? So that yes, no, or no, we plan to, which if you're not, I think it would be great to have a formal program. So if everyone wants to take a moment to take that survey, and I will push the results in one more moment. Okay, so of our attendees, 38% have a formal social monitoring program in place. Almost 27 do not, but plan to, and then another 34 do not. I would definitely encourage, as Dietrich mentioned, the importance of formal social listening and getting that voice of customer or voice of community. But that's what I would encourage as well. So let's move on to step 4.
Thank you, Liz. Step 4 is actually where the fun begins. Explore it. Armed with the insights from your listening program, you should devise a few pilot programs to get your feet wet in social media. So that means identifying a few social media pilots. So, for example, devise a contest to crowdsource new products and services, and then execute and evaluate the outcome of the pilot. Capture learnings to inform refinements and inform next steps. And then a critical piece is to extract data and develop a business case for investing and participating in social media for the future. But beware, don't start something that you can't finish. Even though you're piloting and trying to learn from your experiments, be committed to your success. It takes time and effort to maintain a social media presence. So I want to talk about a company called Medisys. Medisys is a pharma company focused primarily on the treatment of dermatological and aesthetic conditions. Medisys thought about experimenting with a community approach to support marketing for a new product. And by community, we mean a social community. It created a seed community of around 200 people that helped design and co-create the community site. Medisys then provided the content, and the community discussed that content and specific treatment options. The results of the pilot were quite encouraging. Requests for specific products increased by 400% at featured doctors' offices. Visits to featured doctors doubled, and through word of mouth alone, 50,000 women visited the website in the first 6 weeks alone. So that's a great example of an experiment that has resulted in great success. Another example is Humana Cares, and that is just hot off the press. Humana Cares is, as you may know, the complex and chronic care management division of health insurer Humana. It has just announced a partnership with the National Council on Aging to pilot Stanford University's online chronic disease self-management program. For the pilot program, 100 Humana Care enrollees will participate in online workshops designed to provide them with practical skills to better manage chronic conditions such as arthritis, diabetes, heart disease. It will be interesting to see what the outcome of this experiment is. With that, we have another poll question coming up.
Yes, thank you, Dietrich. Pilots are great, especially with social media, because there is no silver bullet of what works and what doesn't, and each company is unique, and different initiatives will work differently with different companies and customers. So a question we have for the audience is, have you launched any social media pilots within your organization? And the answers are yes, no, but we plan to, or no, and we have no immediate plans. So again, if everyone wants to quickly take the poll, we will push the results. All right, one more second here. Okay, so it seems that 50% of you have done some social media pilots. Almost 27% of you have not, but do plan to, and 23% have not done any social media pilots. So based on the Medisys example and others, it's a great idea to start with. So Dietrich, I'll hand it over to you.
Thank you. So the last step, last but not least, step 5, included. As I said earlier, more often than not, we hear that our clients embark on social media pilots and initiatives in isolation with broader strategy. Sometimes there's no alignment with the corporate strategy, let alone with other functions within the organization. So we want to make sure that the social media initiatives are aligned with your corporate strategy. So that means identify and document a clear set of social media priorities, determine a budget that identifies investment resources, gather support from key stakeholders, and as I mentioned before, ensure that the social media strategy is not done in isolation, but also communicate the expected outcomes to employees and stakeholders. A good example of a healthcare organization committed to social media is the Mayo Clinic. The Mayo Clinic has social media woven throughout its operation and also operates a social media site of which Peppers & Rogers Group is a member. And at that site, the Mayo Clinic Social Media Health Network serves as a resource for health-related organizations. For example, you can find white papers, articles, and the like on that site. It provides also webinars, workshops, online training courses, offers consulting and coaching for those healthcare organizations interested in further exploring social media, and allows members to interact with each other for knowledge and information exchange and foster relationships among different healthcare organizations, from payer to provider to pharma. The Mayo Clinic also has a Facebook and a Twitter account where doctors are able to share insights quickly with the Mayo Clinic. With that, we have one last poll, I believe.
We do. And as you mentioned earlier, to include it, you really do need all the stakeholders involved and elevate the conversation beyond just the individual departments. And with that, there needs to be a formal budget to really get a lot of these social media activities going. So a question we have is, have you established a formal budget for social media within your organization? So if everyone wants to take a moment to answer that question, and the potential answers again are yes, no, but we plan to, or no, and we have no immediate plans. So give everyone one more moment to take that. And the majority of you, or 46% of you, have a formal budget. Another 27% plan to, and another 27% do not have a formal budget. So that's a very interesting results for that one.
Thank you. I think Mark, I turn it over to Mark to cover the social media readiness checklist.
Thanks, Dietrich. So, in your thoughts about social media and how you can help your organization navigate a number of the difficult questions that we've been addressing so far in our discussion, Peppers and Rogers Group has created a checklist, and the checklist is designed to help bring to life this 5-step approach and give you and your colleagues a tool to help you figure out and prioritize what you want to undertake in 2012, or frankly in the next time frame that fits your planning, budgeting, and execution cycle, whether that's the remainder of 2012, the next 12 months, etc. And so what I'm going to show you here in just a second is a snapshot of the social readiness checklist. The checklist is available by clicking on the widget at the bottom right-hand side of the On24 console. It is also available on the peppersandrogersgroup.com website. You can type social readiness checklist into the search box, and the link to it should come up immediately. So when you're thinking about how to take action on the 5-step approach that Dietrich has explained, and how to get you and your organization higher on the profile list of companies that are leading the thinking, leading the execution of social media related things in healthcare, we feel like this checklist is a good guide. The checklist is set up where you can answer for each of the critical actions in the 5 steps. You can answer yes, we have already undertaken or completed that particular activity. And if you haven't, you can begin your planning by noting on the checklist where in the upcoming time period you intend to accomplish that. And we've had a number of clients and interested folks fill out this checklist and send it back to us. And we are happy to take a look at it and give you some guidance in terms of what you might consider or what we are seeing out in the marketplace and how it may help you shape your own plans in social media. But I encourage you to take a look at it, certainly to download it, talk about it with your colleagues, and as a tool to shape your own 2012 social media agenda. And Dietrich, I'll turn it back over to you.
Thanks, Mark. To continue, what Mark just discussed, we can certainly help you with the execution of some or all of the 5 steps to ensure social media success. And here's a representation of our typical approach. Our typical approach has 4 phases. The first phase is really assessment and followed by an evaluation of the social media options available for your company. And an executive workshop at the end of this is usually like the social media strategies developed by define the social media strategy. 2, and phase 4 is the launch of pilots and preparation for larger deployment. Critical, and that we typically it was not previously. And these insights allow us then to develop and design social media strategies. The insights and assessment phase also allows the client to level set in terms of its own social media capability, what others are doing in social, in and outside their field, and know what they don't know. Phase 2 is an evaluation of what strategic options are available and most relevant for that company. Companies, as you all know, use social media for different purposes. In other industries, applications like marketing campaigns, brand awareness, advocacy and referrals, public relations and crisis management, customer care are quite typical. For example, Dunkin' Donuts created the Twinter Games in reference to the Olympic Winter Games that year on Twitter, where participants tweet whether they like their coffee or not in order to win gifts. But we're talking about healthcare. So for healthcare organizations, there are other applications of social media available as well. For example, to provide health tips, many Blue Cross Blue Shield affiliated plans have tweeted advice about how to stick to New Year's resolutions to lose weight or eat better. To communicate in times of crisis. When there's a disaster, whether it's a flood, an earthquake, hurricane, or even a terrorist attack, hospitals and healthcare providers are typically at the center of it. Healthcare providers can leverage social media networks to provide real-time updates, both for those directly affected by the crisis and those watching from afar. For example, during the Fort Hood shooting attack in November of 2009, one of the hospitals that treated Fort Hood victims used Twitter to provide up-to-the-minute news. Through Twitter, it provided updates on emergency room access, hospital operation status, it retweeted news from the Red Cross, and also communicated with the press and reporters. As a result, Twitter followers increased 78% in just 3 days, and the hospital was listed on the front page of Twitter as a trending topic. To continue some of the examples, some of the applications, to provide more accurate information to patients. Mark, in the earlier section of this webinar, talked about how a significant percentage of patients search for medical information online before or after doctor's visits. With the magnitude of health information available on the web, both accurate and inaccurate, these patients can easily be misinformed. So by integrating social media into the healthcare marketing and communications mix, organizations can share accurate, timely information regarding symptoms, diseases, medication treatments, and more. Social sites like Inspire and Patients Like Me are providing a forum for patients to share their health problems and questions about treatments with other patients, as well as qualified medical personnel. Another example for social media application in the healthcare industry is to improve patient care and better understand the patient's experience. MD Anderson has moderated social networks that include, for example, the Cancer Survivors Network, Ask the Experts, and the Anderson Network. And so the list goes on and on. You can probably think of a few as well: disease management, clinical trial recruitment, health professional training. For example, a lot of when I interviewed surgeons, they use YouTube videos to brush up on clinical procedures before a critical operation the next day. So these are all options that have to be weighted and aligned with the organization's overall goals and objectives. And the types of resources and investments that are necessary for the particular options under consideration also have to be determined. As mentioned before, social media does take time and effort to maintain and increase user engagement. And so before you start a pilot, you need to commit. And then very briefly, phase 3, as I mentioned before, is the detailed development of the strategy options selected in phase 2. And that comes with a business plan. And phase 4 is designing a few pilot programs for proof of concept and preparing for a broader launch. We obviously do have a lot more detail around the key activities for each phase and the deliverables, and we'd be happy to discuss those with you if you reach out to any one of us. With that, I turn it over to Liz, who will conclude our webinar for today.
Yes, well, thank you so much, Dietrich. We've got a lot of great questions, and your presentation was really, really informative. And it seems like, as Mark mentioned earlier, it's more than just a trend. There's a lot of impact to be had, which you've provided some really great information and examples of that. As with any social media strategy, there's no silver bullet for what's going to resonate with your constituents and stakeholders. And the best step is really to understand your company's and your customers' needs. And so for those of you who are interested in learning more about customer strategy in healthcare, Peppers & Rogers Group has multiple opportunities listed here on this slide. First of all, we invite you to assess yourself with that social readiness checklist that Mark mentioned. You can download it on the bottom right hand of your screen or check it out on peppersandrogersgroup.com. For more in-depth analysis, we can also facilitate some on-site social media and trustability working sessions around your company's unique needs when it comes to social media, trust, or other customer-related topics. And also, this webinar is one of a series within the healthcare space, and we've got one more planned on May 17th, where we'll detail a case study of one health insurer's overall customer-centric transformation. So we hope you can join us for that next month. And all of our webinars, including this one, are archived for your review on peppersandrogersgroup.com, so you can always go back and check out some previous ones that we've done relating to trustability and social media and things like that. And as I mentioned at the beginning, we are very active on social media sites, including Facebook and Twitter. You can follow us on Peppers Rogers or on facebook.com/PeppersandRogersGroup. And if you wanted to check up with some of the posts I added on Twitter, I had PRG Healthcare as our hashtag. So enough about that. Let's get to some of your questions. As I mentioned, we've got some pretty insightful questions. Again, if anyone has more questions, feel free to use the Q&A button, and we'll get to a few today. And any we don't answer right now, we will follow up with an email, of course. So the first question we've got is, we talked about one of the steps being social monitoring and listening. Are there any recommendations for companies that might be able to help do that for the social media in healthcare?
Thanks, Liz. I think, as a strategy firm, we are technology agnostic, and so we do work with a number of different vendors, depending on whether the company already has an existing relationship and so on. But we can certainly, if you'd like to reach out to us, certainly also work with you, and some of our existing relationships that we use for a social listening program, and work with you as well. So the answer is, we've worked with a lot of different vendors, and depending on the purpose, the budget, and what you want to accomplish, there may be different options available for you. But do please reach out to us, and we can probably have a offline conversation about that.
Excellent. And now, speaking of budget, there's a question here. Is there a typical budget for a certain amount for social media activities? What would you recommend when it comes to budgeting?
Budgeting is, it's very client specific. I think it depends a little bit on, again, what the objectives and the strategic goals are, how far along the company is already in its journey in the social media realm. So it can range literally from $100,000 to millions of dollars when it comes to maintaining. Let's say you have a customer care support facility that will take care of chats and social media responses, Twitter responses, to social community creation and development. So there's a very large range in terms of what companies have budgeted. And I think it goes back to the strategy question. What do you want to accomplish with social media? What are some of the applications that you want to accomplish? And therefore, what is the ROI, or can any of these social media initiatives be self-funding from the get-go, or is there a period of time where you need investment up front? So
it is unfortunately not a clear-cut answer because it really depends on your particular situation.
Great. And Mark, here's a question maybe you can answer. How I know Dietrich did already mention some details about making sure that it's social media is included as part of the overall strategy for the company. Do you have any recommendations of how to really elevate that conversation so that it does leave the departmental side and go into the real strategic side?
Sure, Liz. I think that's a critical question. It's one that, as topics like social media take hold, and as they move from kind of the territory for the experimenters in various parts of an organization, and as they move from that status to becoming more widely adopted, more widely recognized as a critical part of an organization's plan and a critical tool in their toolkit, that's a challenge that we have all experienced, and certainly our clients have experienced it. And I think there's a couple of things that have proven to be helpful in the past when these kinds of things have come up. One of those is, and some of these are built into the checklist. So that's a good tool that will also help you address some of the topics that are part of this question, Liz. But I think there's a couple of things that I would highlight. One is the organization. Whether you're in a large organization or a small or medium-sized one, the organization needs to understand what is taking place within its within its walls, within its offices, within its locations, etc. And so, in order to do that, people need to communicate about this topic. And so, there are a number of ways to really stimulate that conversation. Everything from, having a group within the company sponsor a social media summit, an internal one, where, you open up an invitation for folks who either have an interest or are already active in doing things in their departments or in their functions, to join in a conversation. And in doing so, you walk away with a fairly comprehensive understanding of what's happening. Or less formally, on company internal blogs, intranets, employee Facebook pages, and other things like that. Those are all great ways to open up the dialogue to others within the organization and accomplish the same thing, identify what is taking place, kind of across and up and down, the boundaries of your company. I think a second thing to do is to make sure that folks at the highest levels are familiar. Let's make sure we set a manageable goal in the short term. Make sure that executives in your organization are familiar with social media. How to do that? Put it on the topic of the next offsite that's taking place. Put it on the agenda of the next offsite that's taking place. Put it on the agenda of a monthly executive committee or a monthly departmental staff meeting. And it doesn't have to take long. It can be 3 to 5 minutes. And a lot of times executives and other leaders will find it to be a refreshing change from the same topics that they talk about, on a weekly, a monthly, or a quarterly basis. And the final thing that I'll suggest to help make social an enterprise-level dialogue and not a functional or departmental one is, take some of these examples from the webinar today and distribute them, send them, retweet them, comment on them internally, and put them in front of people in the organization. And by doing so, you will help the organization understand that social media is a topic that affects all different types of customers that you have, not just consumers, but providers, other healthcare professionals, hospital administrators, group sponsors, etc., all of the critical stakeholders in your organization. And once people start to realize the prevalence of it, they'll realize that we can't be addressing social media as simply an adverse event monitoring tool, which is critical in and of itself. But we can't address it in isolation because this is not a trend, it's a fact, and it impacts our whole business.
All right, great. Well, thank you, Mark and Dietrich, for this great presentation, and thank you all for joining us today. Unfortunately, we are out of time, so any unanswered questions will be addressed via email. And this concludes 5 Steps in Healthcare's Social Media Agenda, a Peppers & Rogers Group webinar. On behalf of the entire team, I want to thank all of you for attending, and have a wonderful day.